Hi, I'm Dr. McKinnon with Modern Concepts Healthcare. I want to answer a few questions that are frequently asked about chiropractic. Question: what conditions do chiropractors treat? Chiropractors care for a wide variety of patients. We care for patients from infants to the elderly. Doctors of chiropractic, DCs, are known for treating patients with back pain, neck pain, and headaches, but we also treat patients with a wide variety and range of injuries or disorders that may involve muscles, ligaments, and joints. Sometimes these conditions can cause a great deal of pain. Oftentimes, musculoskeletal injuries affect the nerves in the area where the injury is. So chiropractors help to treat any stress or damage to the musculoskeletal system by letting the body heal itself. Question: is chiropractic treatment safe? Chiropractic treatments are very safe. In my office, prior to receiving treatment, you will have gone through an exhaustive consultation, evaluation, examination, and testing before we even begin to make sure you can receive chiropractic care safely. Our treatments are also non-surgical and non-drug. This reduces the risks of side effects that are commonly seen with traditional medical treatments, such as medications or surgeries. Question: will my treatment hurt? Many people find relief as soon as they finish their treatment. Sometimes you may experience some soreness, but usually it's mild and much less than the problem you are having treatment for. Research shows that this discomfort normally fades within 24 hours after your visit. Question: what do I need to tell my chiropractor on my first visit? Your chiropractor may ask many questions. During your first visit, it's important to bring a list of any prescription or non-prescription medications you may be taking. Your chiropractor wants to help you achieve the healthiest, pain-free body possible. They will ask lots of questions. Some questions are general and some are about your daily life. Some questions are related to the reason for your visit. Try to show your area of pain and describe the type of pain as much as possible. Your chiropractor isn't there to judge you, but to help you give the best course of treatment possible. Question: I've been using pain medication to treat my pain for a long time. How can a trip to the chiropractic office benefit me? The risks associated with some of the most common treatments for musculoskeletal pain, over-the-counter medication, or prescription non-steroidal anti-inflammatory drugs, NSAIDs, and prescription painkillers pose a great risk to your body in comparison to the chiropractic manipulation. According to the American Journal of Gastroenterology, people taking NSAIDs are 3 times more likely to develop adverse gastrointestinal problems such as bleeding and perforation. That risk rises to more than 5 times amongst people over the age of 60. Question: does chiropractic treatment require referral from an MD? You can come to our office for a consultation without a referral from your medical doctor. Most insurance companies do not require a referral, and after your initial consultation, we will find out from your insurance company if a referral is required. Question: is chiropractic treatment appropriate for children? Yes. Children can definitely benefit from chiropractic care. They are very physically active and often fall and become injured from daily life. The treatment is very gentle and developed to help reduce any pain or discomfort your child may have from that daily life. Symptoms can include back pain, neck pain, stiffness, soreness, or a general discomfort. Many childhood ailments can be helped with chiropractic. Question: do insurance plans cover chiropractic? Chiropractic care is included in most health plans, such as major medical plans, workman's compensation, Medicare, Aetna, United Healthcare, Blue Cross Blue Shield plans for federal employees, auto insurance and personal injury protection under auto crash claims, plus many more plans. Also, chiropractic care is available to active duty members of the armed forces at more than 60 military bases and available to veterans at more than 60 major veterans medical facilities. Question: what type of education and training do chiropractors have? Normally, a student has undergone 4 years of pre-medical undergraduate college education. Once the student is accepted into an accredited chiropractic college, their study and requirements are even more rigorous. Students have to complete 4 to 5 academic years of professional study. Most of the time is spent in clinical training. Chiropractors have the classes on healing similar to that of medical doctors. In some areas like anatomy and physiology, they receive even more intensive education than their MD counterparts. After their 4 to 5 years of clinical classroom education, they must spend more than 1 year in clinical-based program performing as a student doctor. So the average DC has about 4,200 hours of classroom, clinical, and laboratory training. Chiropractors have been trained like this in the United States for the last 25 years. Question: how is chiropractic adjustment performed? Chiropractic adjustments or manipulations is where a chiropractor uses his or her hands or an instrument to manipulate joints to help restore function. These procedures are highly controlled and rarely cause physical discomfort. Each adjustment is adapted to meet the individual needs of the patient. We use computerized chiropractic instruments so that it is very gentle for all of our patients. Is chiropractic treatment ongoing? The hands-on nature of chiropractic treatment is essentially what requires the patient to visit the chiropractor a number of times. Sometimes more than one visit is necessary. Since treatment is hands-on, every treatment plan is different. Your chiropractor will tell you what your treatment will be, how many visits, how many weeks, etc. In our office, we do what's called corrective care, which has a specific number of visits over a specific time frame. Once completing a plan of care to correct an issue, many patients choose to do ongoing maintenance care on a much less frequent basis to make sure they stay as healthy as possible. Question: why is there popping sound when a joint is adjusted? When your joint is adjusted, gases between your joints can shift and release. The noise is the change of pressure within that joint. Normally, there isn't any discomfort involved, and the results in the greater range of motion and less pain within the joint.